Hello everyone, myself Dr. Nikhil Kajale, practicing dermatologist in Nasik since 8 years. Today we will discuss about atopic dermatitis. So what is atopic dermatitis? Atopic dermatitis is a skin condition characterized by severely itchy rashes all over the body which may present in childhood and which may progress to the adulthood also. So why it occurs? As definition, it is a genetic disorder which is may present since birth and it is associated with increased levels of allergy. So this increased levels of allergy causes damage to the epidermal layer of the skin. Epidermal layer is the uppermost layer of the skin which causes disruption in the barrier function. Normally, our epidermal layer or uppermost layer of the skin protects us from the external antigens like dust particles or any other allergic particles, which will help us to develop allergies. But what happens in this atopic dermatitis patients? There are disruption in this epidermal layer, which causes loss of water from our skin and which causes more dryness. And this dryness, along with that disruption in the membrane, which helps in the inflow of the various antigens like dust particles or any other antigenic material like viruses and bacteria also, which causes damage to the systems, and our immune system, which is already in having increased levels of some antigenic potential antibodies, we call it as IgE antibodies, which helps us protect ourselves, which causes which attacks on that particular area on the skin and leads to inflammatory process at that particular point. So because of that inflammatory process, patient develops very severe itching at that area, and which leads to continuous scratching and subsequent exacerbation of the disease. So what are the clinical features or clinical presentation of this atopic dermatitis cases? Okay, now there are various ages which we can classify this, like there is infantile phase in which the patient presents with since childhood, or you can say since birth, infantile phase, so which lasts from day 0 to day 1 to day 1 year of life. So patient usually presents on the rashes on the face, on the limbs, extremities and on the trunk, but usually there are various small reddish papules and lesions which are severely itchy, and because of that constant scratching, patient develops various rashes on the face, red color erythematous patches on the face and the limbs. As age progresses, like from age 2 to 5 years, the presentation is slightly different than the infantile phase. We call it as a childhood phase. So at that phase, the lesions develop usually on the extensors of the limbs, because patient started crawling, and after patient may go outside, which exacerbate the dust exposure and antigenic material exposure, so which helps this disease process to aggravate. So there are various sketchy scratches are there, and various red color itchy papules and rashes are usually seen on the extensor surface. Many patients who sweats a lot, and that cases there are various flexural preponderance is also there, like where sweating is there more in the axilla and cubital fossa and groin area, and on the neck area also, where sweating is more at that site also there is exacerbation of the disease. As age progresses, like in childhood to adulthood phase or adolescent phase, the presentation increases, like because of constant itching since several years, the thickness of the skin goes on increasing, and which leads to constant thickening and darkening of the lesions. So dark patches are developed usually on the extensor surface, like on the nape of the neck, on the extremities and on the legs, and which we call it as a lichenification. Lichenification is a process where there is thickening of the skin, and which usually doesn't respond to much to the treatment, and it will take much longer duration for the same. And the lately patient may develop in the latter, like elderly also has some allergic potential to this, because in elderly there is again a decrease in this epidermal dysfunction layer, and there is a loss of lipid material, which again leads to various dermatological lesions in the later phase of the life, like after 60 years of age. So these are the various presentations of this atopic dermatitis. But there are also few very uncommon or few other minor features are also seen in this case patients. What are they? So there are few like white spot on the face. We usually call it as a deficiency of the calcium or deficiency of the micronutrients. So these patches are on the face. We call it as a pityriasis alba. So like that, and creases around the eyes. We call it as a denim organ fold. Swelling of the eyelids, seborrheic dermatitis like dandruff, like patches on the scalp, and also the sweating, the causes itching, which is a major complaint in these atopic dermatitis patients. So these are the few uncommon presentations in the patients of the atopic dermatitis. So what is the treatment plan and how we can manage it? So most important thing in the management of this atopic dermatitis patient is the counseling. Patient as well as the patient's relatives or parents has to know this thing. The patient course is very prolonged, treatment course is very prolonged, and we have to take care of the child, or we have to take care of the patient's overall home management, which will help for the doctor as well as the parents to prolong the remission period. So most important thing is we have to hydrate the patient well, and use plenty of emollients or moisturizers. Usually bland moisturizers are very much helpful. So use of moisturizer is the first and most important thing in the prevention of this atopic dermatitis as well as in the treatment part. Basically use of mild fragrance lace or any mild moisturizer is very much helpful in the atopic dermatitis patients. So use of constant moisturizer, even including in the summer season and winter season and rainy season also, is helpful. So continuous use has to be advised to the patients. Then we have to reduce the use of hard water, very hot water, and also hard soaps. So we should ask patient to use the very mild soaps. That too, if you possible, we can use twice a week or once a week therapy for the use as recommended in this atopic cases, because soap causes more dryness and subsequently which may increase the risk of the lesions. Then come to the treatment part. Then when we seek the doctor. So if you find without use of with use of moisturizer the skin lesions are still increasing, then you have to seek the doctor, your dermatologist, and with the treatment, mostly the topical treatment is usually sufficient along with antihistaminic treatment. So antihistaminic is very much required to reduce the itching. Usually first generation antihistaminic is preferred in these cases, which helps patient to reduce the itching, and because of that constant scratching, it reduces the exacerbation of the lesions. And topical steroids and various other like tacrolimus and some immunomodulators are usually a treatment of choice in this thing. But in severe cases of atopic dermatitis, one has to use systemic therapy like systemic corticosteroids or any other immunosuppressant like methotrexate and cyclosporine. So these are a few modalities of the treatment of these atopic dermatitis cases. Apart from that, there are various immunobiological therapies which are very much important. Nowadays, various probiotic therapies are upcoming in the medical fraternity, because we think that the probiotics helps in our digestion and the regularization of this GI tract, which helps us to reduce the intake of the antigenic material, which leads to subsequent reduction in the allergies. There is some controversy regarding the food, what food should be avoided and what food should be taken, but still the food which has some antigenic potential, that can be avoided, or the food which causes increase in the itchiness, that can be reduced with the help of experience of the patients and the children. But there is no hard and fast rule regarding the food which has to be taken and which should be avoided. So this is the general guideline or general overview of this atopic dermatitis patient or atopic dermatitis. Another most important one factor I missed is we have to protect our kids from the insect bite, because this patient has tendency to react more profoundly to the insect bite reactions, which causes continuous scratching and which will aggravate the symptoms of the atopic dermatitis. So this is a simple overview of this atopic dermatitis. So I hope this will helpful in your understanding the disease, and this will help you to judge the severity of the disease. But definitely you have to use constant moisturizers. Good quality moisturizers are very helpful. Even use of coconut water, coconut oil frequently helps in the this moisturizing the skin surface, and which reduces the flakiness and the itchiness of the skin. But definitely you have to seek the dermatologist help whenever required, and whenever you see there is increase in the lesions, which will help patient to live his life comfortably. And because we all know this is a very recurrent disease, the quality of life or quality of life of the patient is very much important, because if quality of life is improved, even quality of life of the parents and the total family is beneficial. So this is the most important thing in this treatment part of the atopic dermatitis. Thank you very much.